Hi, my name is Tamia Singleton, and in this video, I will demonstrate how to insert a nasogastric tube. So first, I'm going to verify my physician's orders. Then I'm going to verify my patient by checking their armband with the procedure part. Next, I will wash my hands and don clean gloves. Next, I will place my patient into high Fowler's if it's not contraindicated. In this case, it is not. Now, I'm going to drape my patient, and to the side I have my MSM basin, ice, water, and tissue if needed. Okay, so now I'm going to assess my patient's nose. I'm gonna occlude one side and ask them to breathe through, okay, to check the patency. So we're gonna use the left nares. Okay, now I'm going to measure my tubing. I'm going to measure it from the tip of the nose to the earlobe, all the way down to the xiphoid process. I'm going to get my tape and mark it. Then I'm going to lubricate with my water-soluble lubricant, 3 to 4 inches. Now, I'm going to go in. I'm going to ask the patient to put their chin to their chest and swallow as I go downward and backward. And if the patient experiences any distress, such as coughing, gasping, turning blue, if they are unable to speak or hum, I will stop the procedure. But since the patient looks like they're tolerating it well, I'm going to continue with the procedure. Okay, then I'm going to temporarily place my tape. Now I'm going to check for placement. To check for placement, I'm going to aspirate the content, the pH content, and then I'm going to compare it with the pH strip, or I can check the placement with an x-ray. Okay, now I'm going to securely after that, I can go ahead and connect the tubing to the feeding pump, suction, or clamp as ordered. Once that is done, I can wash my hands and take off my gloves, then wash my hands. Then I will document the procedure. I will document the size and type of the tubing, the gastric content, the placement verification, the nares used, and the patient's response. Hi, my name is Tamia Singleton, and in this video, I will demonstrate how to remove a nasogastric tube. First, I'm going to verify my physician's orders. Then I will identify my patient. Then I will explain the procedure to my patient. Next, I will wash my hands and don clean gloves. Then I will disconnect the tubing from the suction, the feeding tube, or whatever. Then I'm going to drape my patient. Then I'm going to give my patient a tissue. Now I'm going to remove the tape. Okay. Then I'm going to ask the patient to hold their breath. While they're holding their breath, I'm going to slow and steadily move the tubing out of their nose. Then I'm going to discard the tubing. Now I'm going to perform nasal as well as oral care to the patient. Now I will take off my gloves, wash my hands, and document.